Friends and colleagues, thank you for joining us at the second plenary session of the 46th World Hospital Congress. Please give a warm welcome to the chair of this session, Dr. Preetha Reddy, Executive Vice Chairperson of Apollo Hospitals Enterprise in India.
Good morning, and it's delightful to be here with all of you. And I must say that the little bit I've seen about Lisbon and the culture of Portugal, I'm amazed, and being an Indian, the warmth and the hospitality is like maybe surpasses us also. Thank you all for the invitation and being here this morning. The topic of employee well-being is probably the most discussed today, especially after COVID-19, because we all realized when we're representing our own country's healthcare systems that the employees in the organization, they work so hard, they really put aside their normal lives for this. And as a thank you to them, I think for us to focus on well-being is so much more important. We have to lead with people as a priority. It is a hot topic. And every organization should have employee well-being as part of their strategy. I quickly want to tell you that I come from the Apollo healthcare system, and my father, who started this as the chairman, would always tell us that you could build beautiful hospitals, you can equip it with the best technology possible, the banks and private equity will come and fund you, so you don't have to worry so much about the money. But it's the people who make a difference. It's the people who count, and it's for the people that you have to do what you have to do and think about them. So I think today is dedicated to the millions of healthcare workers around the world who tirelessly work to make the world a better place and to heal us and for ourselves, for our patients, and for the future generations. We have a fantastic panel here today, and I'd like to welcome all of you. We have Pedro Delgado, who's the Vice President of the Institute of Healthcare Improvement. We have Dr. Henry Gallardo, Director General, Fundación Santa Fe de Bogotá in Colombia. We have Dr. Graco Alvim Neto, Director of the Association of the Hospitals of the State of Rio de Janeiro. And of course, Dr. Raquel Chantre, Board Member of APAH. And there will be a great panel discussion after their presentations. Raquel Chantre, who will follow me right now, has done a lot of work on just seeing how the employees' sensitivity is, how they respond, and what they feel about the organization. And this is a study which was done in Portugal. I want to acknowledge the fact that they have been very forthcoming by allowing this to happen. So thank you for the Association of the Hospitals of Portugal for doing that. I would also like to acknowledge the fact that Professor Arnon Afek, we do miss him, and we were looking forward to his presence here today. But we all know and we feel for what is happening in the world. And IHF very strongly has a stance which says that any violence against healthcare workers is completely unacceptable in our systems, and we have to nurture, we have to protect them and take care of them and not allow any sort of violence against healthcare institutions or workers. So having said this, I welcome you all to this wonderful morning, the great discussions which are going to be following. And I'd like to call Raquel to come and take us through the amazing work which she has done. She is the board member of APAH, the Portuguese Association of Hospital Managers, and executive board advisor at Central Lisbon University Hospital Center. And she is pretty special because I asked her what is her personal mantra, and she said, kindness is not a weakness. I think you have to give her a big hand for that, because it truly is not a weakness. Raquel, over to you.
So thank you so much. Thank you, Dr. Preetha. So good morning. Thank you all for joining us here this morning. I have to say that for me it is a great honor, a true privilege, and a great responsibility to be here on behalf of the Portuguese Association of Hospital Managers. What I'm presenting you this morning is the results of the Portuguese National Health Service assessment. And I will tell you a story, a short story. I will not be boring you that much. I will tell you a short story that actually answers the questions who, what, when, how, when, and why. So to respond to the who, so the Portuguese, I have to say that the Portuguese Association of Hospital Managers is a professional association that is 40 years old here in Portugal. So our members are hospital managers and hospital administrators. And we have in our constitution that states that we shall promote a study and discussion of relevant topics. That this for us is an obligation, So for that reason, we decided to do the Culture of Care Barometer early at the beginning of this year, because we started thinking about human resources and the fact that we needed to improve human resources management. So how could we do that? How could we start doing that? So the answer was we needed to listen to people. And this tool that we applied does that. It listens to people. It listens to our resources. So we apply that to all the health professionals from all the Portuguese national health system organizational levels, the public hospitals, with over 145,000 employees. This was the first edition done in March this year. And we adapted the tool that the King College London already has. We translated it to Portuguese, we validated it, and we applied it with minor changes into the Portuguese to evaluate the culture of care in our institutions. So the instrument is a short 17, 30 self-reported items online questionnaire that is linked to 4 factors. So it evaluates the organizational values, team support, relationship with colleagues, and job constraints. So we listened to people, and what people told us was, we got over 9,000 responses, which is around 6.5% of the healthcare population in the public sector, which is quite good. We had responses from both primary care and hospital sector. 78% of the replies were from the female, 33% around between 40 to 49 years old, 44% nurses, 15% doctors. So these results are overlapping the reality of our hospital and healthcare institutions. So the main results were that in global, the healthcare workers feel that they are integrated in their teams and supported by their superiors. So that's good news. 75% of the workers know what is expected from them. Also great news. 70% feel they are respected by colleagues. 34% consider they have the time and resources needed to perform well. Well, I would say that's not good. 34%. 56% do a negative evaluation regarding either the hospital setting or the primary care manager's perception of the care activities. So this, for us, hospital managers, is also not good. 20% of the workforce feel they can influence decisions, and only 18% feel they are heard. That is why it is so important to listen to people. 4 out of 5 workers have a bad or neutral opinion about how organizations celebrate employers' success. And this, as I said previously, was the first edition that we did this evaluation, this assessment. And we did it with the collaboration of the Executive Board of the National Health Service, the College of Psychologists, and also with the support of the EY. And we needed to have also the support of the National Health System shared services to help us disseminate the questionnaire to all the professionals. So this is also a collaborative work. This is something that we as a professional association would not be able to do by ourselves. So we need all these people involved to do this, the first national assessment on how people are feeling in our institutions. And this is rather important when we know that we have human resources constraints in the healthcare sector all over the world. And we cannot act on feelings, we need to act on information, and this is why this is so relevant for us. Just to say, before I finish, that this was the first edition. We are now working with Nova School of Public Health to revalidate in a more robust way this tool, and we pretend to apply it again at the beginning of next year to get, this is the baseline, and we want to start to build the puzzle, the picture of how our institutions and the healthcare force is feeling. So key takeaways. The organizational culture of healthcare providers is directly related to the quality and safety of patient care. When workers feel that they are unheard, they reduce their commitments to the organization. Additionally, when workers feel they are undervalued in this institution, it affects their engagement. So could this be the baseline for a new human resources management national strategy? Hopefully so. This is our effort. This is what we are pushing forward. So I'll leave you in reflecting to this. If we want to create cultures of high-quality, compassionate care, then we need to have leaders who embody the value of compassion as part of their continually improving high-quality leadership. This is about compassionate leadership. So I thank you all for listening. Okay, now let's go for the fun part. We have a pool prepared for you guys. So while we wait until it's on, if you're not already downloaded the app, please do so. Download the app of the Congress, go to the plenary session number 2, and then go to the pool folder, please. Yes. So question number 1, do you think, imagine yourself in your country, in your institution, do you think your organization would get the same result as 75% of the workers know what is expected from them? Will it be higher, the same, or lower percentage? Please do vote.
While we're waiting for the poll.
I think in Brazil, I would consider less because lower, of course. And we need to improve more understanding before the people entering the organization, how they can know what is the job name and the job instructions. And so I consider Brazil lower in this aspect. Surprised me like a big number, like 75%. Of course, when you have like higher like in the established or the hospital, like doctors, nurses, they know what they have to do. But like when you go to the basic like jobs, I think that we need to improve on that.
So I think the answer is that we have to be very clear on what we communicate to our employees and let that 75% probably go up to 85% in all our systems. When there is clarity, it shows that we care. And so that's a lesson, I guess, for us. Do we want to go to the next question?
Let's go into the next question. So do you think your organization would get the same result as 34% consider they have the time and the resources needed to perform well? Please do vote.
Dr. Henry, do you want to comment while the poll is going on?
My first reaction is that I would love to have the survey done in Colombia. I have some kind of envy because you have the numbers and we don't have it. So congratulations on that. And being transparent with this data is so important. My perception is that my people will answer that they don't have enough time, but they have the resources. And managers, we have a challenge because we always think about their resources, but not the time. So I let it there.
Thank you. So
the fact that it's higher is encouraging, Raquel.
What? Sorry.
The fact that it's higher from the audience is encouraging. So I think we should keep investing in the resources.
Yes, I think it's encouraging and we need to measure it because the feel like can be different from real life. And I guess I have to agree with Henry because time is the more consuming resource that we have. It's the more trickery resource that we have and we need to manage it well. And the perception that people have, that they have to have time to do, is something that also needs to do as managers to work on it. But it is encouraging.
Yes, it's encouraging.
It is encouraging. So let's move on to the third question. Okay. So last question. Do you think your organization would get the same results? Only 20% of the workforce, the Portuguese workforce, feel they can influence decisions, and only 18% feel they are heard.
So I'm glad it's showing higher. I want to give you a little example. In our hospital system, one of our oldest hospitals, there was a consistent traffic jam every day coming into the hospitals. And so the employees had to bear the brunt of people's angst. So they came and they told us that, you really have to invest in a multi-level car park, which is quite expensive, for us it was. And we said, I think we need to do it. And it was a great example because the NPS scores of patients went up. They were less angry when they walked into the reception, and the employees felt that they were heard. So I think these are examples which show that, they need to feel that they're heard.
Yes, and it's also encouraging that 46.6%, 47% of the people in this room feel that they can perform better. So communication in times of adversity is a really crucial factor. So the key lesson is, for me, doing this, the part of this team that did this study, is people need to be heard. We have to listen to people. So thank you all.
Thank you. Thank you, Raquel. I know the amount of work which went behind doing this, and I think all organizations will appreciate the fact that employees have to be cared for, and their voices have to be heard, and they have to feel empowered. Our next speaker is Pedro Delgado, Vice President of the Institute of Healthcare Improvement, who will talk about the IHI's work on employee well-being, joy in work. And when I asked him, what is so special and what is his special mantra, can anybody guess what he said? He said it's curiosity. And I think that's great because, when you have an open mind and you're curious, you want to ask questions and you want to learn, then so much more comes from the employees. So thank you, Pedro, for being curious forever.
Thank you. I'm going to ask you to do some unusual things, so I hope that we can play along. The first thing I want you to do is to stand up. I promise there will be no dancing, but I do want to start with something that we underestimate, and it's gratitude. So what I want you to do is give yourselves 10-second applause and to look at two people near you and say thank you. And if you can stay standing up, when I got the invitation from Linda and Ron and Henry and so on, I was astonished at the size of this federation. And I just want you to realize when you come into the sacred space that is the federation, you get to understand how many people you oversee around the world, how much money you have in your hands to do goodness, and the power of and the possibility within influencing a healthcare environment that is moving very quickly. So internalize that and leverage it for goodness. In healthcare, we're a benevolent industry. And in a world that's a little convoluted right now, we need you. We need you to continue doing good work. So I want you to have a conversation for 3 minutes with the person that's next to you, answering two questions. One question is, what makes a good day at work? What makes a good day at work? Question number one. Question number two is, what are the pebbles in your shoes? So what are the impediments to you having good days at work? So what makes for a good day at work, and what are the pebbles in your shoe? What are the things that piss you off, the car park issues, and so on? So if you can invest 3 minutes in doing that, just very quickly, whatever comes out, and don't go on, just one or two things. What makes a good day, and what are the pebbles in your shoes? Okay, if you can hear me, clap once. If you can hear me, clap twice. If you can hear me, clap 3 times. And we can take a sit. Now, I hope that you take the time to follow through with that conversation. We could have done it in an hour, frankly. What are the things that bring us joy? And what are the things that are challenging about our work? And keep the two questions in mind, because I'll refer back to them in a second. We have a tendency at the Institute. About 7 years ago, we published a framework called the IHI Framework for Joy in Work, in response to the increasing evidence of burnout in healthcare. So we could have written a guide or a framework on burnout or preventing burnout, but we have a pathological sense of optimism, so we flipped the coin, and we turned it into joy. So I'll reflect on some of the experiences of applying that framework. But let me invite you to this. This was a picture taken with my phone about 4 weeks ago. Anybody want to hazard a guess of where that is? It's Cuba, right? It's Cuba. Somebody said Venezuela. Maybe some parts of Venezuela, but it's Cuba. It's Havana. I was there with about 30 senior fellows for health equity. from around the world. And we were doing field visits just to reflect on some of the Cuban reality of healthcare and beyond. And I met Fernando in this Finca Marta. This is a farm that was probably the most astonishing part of the visit, for me at least. When I met Fernando, its creator, I got to know him a little bit, so we spent about an hour having a conversation, and he said a few things that were really striking. Fernando was a very successful PhD-trained academic in the Netherlands, working on agriculture. His thesis was titled Farming as if we were going to stay, so farming with an eye to the long term. But he said two things that reminded me of the work that we do in healthcare. One was his intuition when he was in the Netherlands that it just wasn't enough to teach about all these magnificent things that he had in mind for agriculture, for organic farming, for agriculture being an epicenter of goodness in terms of generating jobs, building community, generating good nutrition, and so on. He said to me, I woke up one day and I thought, I need to dream about all these things that we can do, but I need to dream by doing. And that day, he made the decision to go back to Cuba. And when he got back to Cuba, he got a derelict house that he started to work through. There was no running water, no electricity, and he's built it over the last 17 years to what it is right now, which is a network of 80 farms with Finca Marta, the one I was in with him, his home being the epicentric one. So dream by doing. And I think there's something in what we do in healthcare around employee well-being, putting people first, which needs to translate our intent of goodness and fraternity and so on into reality, into tangible things. And that's what I'm going to give you at least one example of in terms of the joint work. So dream by doing. The second one was as important. He said, Pedro, agriculture shouldn't be seen as just as a transaction or as a business. Agriculture is a social process. Agriculture is a social process. I think healthcare is a social process in the way that we deliver it, never individually, heroically, always with teams. And it's a social process in terms of what we do outwardly, the impact that we can have in society. If somebody comes into your institutions and gets a terrible service, they get harmed, they wait too long, they walk into a terrible waiting room and so on, they take that home. If they walk in, it flows well, it's exceptionally good, they're highly regarded, they feel listened to. It's just different, and they take that back to society. So dream by doing and healthcare as a social process are two things that I want you to take through the next 15 or 20 minutes together. It's certainly something that I get to experience with the groups that we have the opportunity to work with across the world in terms of the work that we do. Dream by doing, a bias to action, and the social element of what we do, always in community, always in community. So I want to give you the kind of high-level framing of how we see employee well-being, and then land into the examples of applications of the framework of joint work. So the triple aim, better care, better health at sustainable costs, the simultaneous pursuit of better care, better health at sustainable costs, is a framework that has created traction around the world. In 2014, there was a sense that there needed to be one more thing, and it was staff well-being in 2014. And then last year, of course, because this cannot be, healthcare cannot be an endeavor that only benefits some who can afford it. Health equity was integrated into what's now not called the triple aim, but it's the quintuple aim. And this is a grounding principle, in a way, a compass for all of us to try and guide our efforts as healthcare institutions, because the question is changing, we feel, from this perception that all we needed to do was to provide a defect-free service to a different question, which is around the value that we bring to society. It's about the value that we bring to society. What is the contribution? It's not enough just to provide an exceptional service. We need to bring value through what we do and how we do it, value through how we treat our people, how we listen to our people, and so on, because they will go back to their homes and take what they get from healthcare into their homes. Our patients will also do the same thing. So with that in mind, let me just give you a few examples. The examples are grounded in experiences primarily from Latin America, where we're working in Brazil with about 100 institutions, in Colombia with about 20 5 in Mexico with about 14, a little bit on Australia, and some. I know there's a lot of people from the NHS here. I live in the UK, so some of the experience, in fact, the epicentric one, Newcastle, will be in the NHS. So I'll go into that. Everything that I'm going to say from now on is based on the framework. And a framework is a framework. All frameworks are imperfect. Some are useful. So we've produced this in partnership with many of you by listening. As a non-for-profit institution, that's how we reinvest any margin that we make. It's by producing white papers that are free to use. And these 9 dimensions are, in a way, a guide to how, from learning from outside industry and inside of healthcare, to how we could think about joint work. So the process of landing or translating a framework into practice is always complicated. So I'm going to oversimplify it. And you, in a way, started us. So what we invite organizations to do is across every microsystem, every unit in the system, to ask 2 questions. The questions I asked you. What matters to you? What makes for a good day at work? And the second question is the pebbles in the shoes. What are the impediments to you having a good day at work? And what that does is it gets to the gap that you highlighted, which is people feel listened to. People feel listened to. We ask them and we listen. That takes courage to be able to listen and to do it at scale, not just a few senior leaders, but everyone across the system. So those are 2 fundamental questions in the ladder of getting to joint work, which is clearly connected to better outcomes. In the case of Newcastle Trust in the north of England, they've canvassed about 8,500 people out of their around 16,000 employees so far through a number of mechanisms. And the main question was what makes for a good day at work and what are the impediments to you having a good day at work. That was done virtually and in person. These are some of the teams from, actually from Brazil, but I could show you the same picture from Newcastle. So you harvest that information and you process that information and you build a commitment to making joint work a shared responsibility across the system. So this isn't a senior leader's job only. This isn't the director of organizational development's job only. This isn't the director of human resources job only. This is a shared responsibility. And because you've asked everyone, they're generating solutions that are connected to a higher purpose. So a overall aim for the organization, and that are locally relevant. So the way that you may process this information is through tools like a Pareto chart, where you find the highest frequency contributions from the combination of those 2 questions. In the case of Newcastle, there were 3 of the domains of the framework that were top in terms of the things that people brought up: autonomy and control, physical and psychological safety, and participative management. No surprises here. So what they did and what we worked together on was to frame an aim. And the aim was based on the NHS annual survey, the same survey that you use here that have translated and so on. And they wanted to see a change over time around one of the questions by working on the 3 drivers from the Joy in Work framework, and by then going deeper into what that meant in practice for them. All improvement is local. So for Newcastle, listening to their employees, this is what mattered to them. This is what mattered to them. So you create the organizational driver diagram, and then you invite people locally to adapt that and practice and test ideas for solutions. And what they did in Newcastle, which I thought was clever, was to try to create leadership behaviors associated with each of these 3 drivers, so that in the civility creation space of how we relate to each other, people know what was expected around each of those 3 drivers. And then, of course, there's no use in putting things on paper and things looking beautiful on strategy. How do you land it into practice? How do you test changes that are going to actually get to making more better days at work and to addressing the impediments to having good days at work? Again, listening and acting, local teams empowered, feeling listened to, feeling heard, and taking action along those 3 drivers with their change ideas that are locally, and then just testing those changes and measuring the impact of that in real time. In the case of Newcastle, we've structured it as a set of learning collaboratives with different waves, initially with 2 teams, then 5, 20 more, and so on. Over 250 teams have already been engaged in this effort using the model for improvement. So after you've done your diagnosis, 3 questions. What are we trying to achieve? So what's our aim? How much, by when, and for whom? Secondly, the measurement. How will we know that a change is an improvement? And third, the locally driven answer to what changes can we make that will lead to improvement. And then this plan, do, study, act cycle, continuously improving what we do in order to address the things that matter to us, in order to get to better well-being and potentially even joint work. This is a driver diagram from Colombia, just to connect the model for improvement to the 3 questions: the aim, the idea, the measures, and then the ideas. So that's a little bit. And then in Newcastle, in terms of the annual survey, some of the early shoots, this is an annual survey, so they have 2 mechanisms of measurement. One is a monthly, locally developed mechanism to try to understand how people are feeling. And secondly is the official national NHS survey. These are some of the early results from the NHS survey. We visited in September 22, together with some of the senior leaders of Newcastle. We walked around the hospitals of Newcastle, and these were some of the culture shift issues that we were seeing, the impact on staff that we were observing, and obviously, which is the reason why we do this, staff who feel well, who feel joyful, provide better care, because you cannot give what you don't have. You can't give what you don't have. Last example, Royal Free Hospital in London. Same principle. So staff were feeling not listened to and so on. And in theaters, in operating theaters, there was a sense of co-production. So staff were invited to answer the 2 questions: what matters to you? What are the impediments to you having a good day? Surface the ideas, worked on a theory of change, and then test the changes to try and get to better outcomes. And the better outcomes are here. Turnover down, agency use down, appraisal rate up, temporary staffing down, and one of the measures that moved less than we wanted to but still reduced was sickness. So again, people feeling listened to, locally driven ideas connected to the higher purpose and mission of the organization, tested locally and measured in order to address the issue of challenges. So I'll finish with this. There is a reality that we have in every one of your organizations, which is we have official organizational charts. There's a box at the top, there's a number of boxes in the next layer, and then from there down. That's what John Cotter calls System 1. It's a kind of official infrastructure, the quality committee. The System 2, though, and the reason why the joint framework implementation strategy probably gets to the heart of things is because it doesn't all happen through the lines and arrows that are in that organizational chart. There are dynamic networks of people who make things happen. Informal leaders, maybe, who have charisma, who have generosity, who feel compassion, who have empathy, who connect with people deeper, regardless of where they stand. I remember hearing from Henry and Adolfo about a waiter in their cafeteria who was the embodiment of the behaviors that they were expecting from the medical leaders of the organization, but this guy just had it. He just showed up and had it. So it's important that we consider when we think about well-being that all the arrows and boxes and so on is something that we have as part of the bureaucracy, that we have structured, the construct that is an organization. But this system too, the dynamic networks, are as important. And of course, the last thing at the top is that investing in leadership is huge. And I know that you're all doing that pretty intentionally. When we talk to the IHI Health Improvement Alliance Europe leaders from across roughly 40 organizations in Europe, and asked them when we were in Pärnu in Estonia in June, what they thought were some of the key leadership behaviors to drive things like employee well-being, safer care, and so on. They mentioned one word, and it's a word I mentioned to you: curiosity. Curiosity. It takes curiosity in the domain of leadership to be able to do this well, to work towards staff well-being, putting people first, which is the title of this session. So the 5 simple rules that we co-created with the IHI Health Improvement Alliance Europe hopefully will resonate with you, and I'm sure you're all practicing them. So the first one, ask rather than tell. Listening starts by asking. In leadership positions, we're too often used to giving answers. And that's the expectation. We know it all. We're expected to give answer. Ask rather than tell. Secondly, listen to understand rather than to respond. Again, our intuition is that we as leaders are expected to just have responses immediately. Listen to understand rather than to respond. Thirdly, it's just easy to hear the voices that we always listen to. And you know who they are. They stand in the same meetings, in the same rooms, and they're always the voices that we listen to. Can we make room for every voice and not just some of the voices? Prioritize problem framing rather than problem solving. And then the last one is to accept that sometimes we don't have all the answers. To treat vulnerability, I don't know, but let's figure it out together, as a strength rather than a weakness. And of course, you do curiosity because you're trying to foster, first of all, authenticity. You need to be authentic about this. But secondly, psychological safety, the stuff that Amy Edmondson keeps reminding us of. Creating an environment where people feel listened to and able to give their opinion and respected for what they bring to the table, which is wisdom. Wisdom. So I'll finish the story back in the farm. The first thing that Fernando did when he went back to Cuba was to go to his neighboring houses near the farm and knock on doors and say, I'm Fernando, we're trying to do this project, I'd love for us to work together. And he met Juan Machado. Juan, listen to this, I didn't even know this existed, is a well finder. I was speaking to Juan, who's 86, and we were standing in a piece of grass, and he said, Pedro, there's a well there. There was just grass. I was like, I don't see a well, but I believe you, Juan. Tell me more. And he kept going on. When Fernando knocked on his door and he heard that Juan was a well finder, he brought him to the farm and said, we don't have running water. Can you help us? He says, there's a well there. And they dug by hand for 7 months. For 7 months until they hit water. And then from there on, the rest is history. As we do the work of improving health and healthcare, as we do the work of finding wells, well-being, goodness in healthcare, continuous improvement, let's just be persistent and understand that this is going to take time and constancy of purpose. Constancy of purpose. So I'll leave you with these three things as we go for joy together. And I think it's possible. And the power that you have and the reach you have is something to celebrate and to leverage for goodness. So the three things: work on your curiosity quotient. So we have IQ, we have EQ, emotional quotient, and we have curiosity quotient. Work on your listening skills. Listen better. Secondly, co-design and co-produce. Do this with your people. And then the last thing, and we started with gratitude. Express gratitude as often as you can. Make it a point every day that you go into work to say thank you to 3 people for the work that they're doing, and nurture psychological safety. It's a privilege to be here. I hope you have a lovely rest of the Congress, and I look forward to our conversation.
I'm back again, but it's a hard act to follow. I'm going to try my best. How many of you are really committed to this curiosity quotient? I learned that today, so I can't raise my hands. Can any of you raise your hands? How curious are all of you? Good. I'm just curious to see that when we leave this room, how many of us will really pick up the lessons which Pedro taught us, go back, be great listeners, be empathetic to our employees, and try and really tell them that we care and they will make a difference. I think then all that he told us and walked those many steps would make a huge difference. Thank you, Pedro. Give him a big hand, please. Okay. I love saying this, but we're humans after all, and sometimes there are technical glitches, and there is nothing we can do about it. So you'll have to just bear with me, and when the slides come up, we'll fast track to the slides. So ladies and gentlemen, for all of us who are here, there's no going away from the fact that we are in the business of caring. And the business probably comes after the caring. And who are our partners in caring are definitely our employees. And our employees stay with us, they stand with us, and they do what they have to do day in and day out, because at the end of the day, it's the people who walk into our healthcare systems who have to be taken care of and nurtured. So when we look at our employees, we really we look at it from two sides. One is that, as leaders, are we recognizing them? Are we giving them a seat at the table? Are we at least patting them and telling them, listen, you guys, we care about you? And the second is really the whole scientific piece, which is the mental and the physical and the well-being aspect of employees. So we look at it literally in two ways. And I'll give you an example. We go through Joint Commission accreditation, and it was probably one of our surveys in one of our hospitals. And when the surveyor asked the housekeeping boy and said, what is it you do? And, there's whole data and there's a science behind what he does. And he said, I save lives. So that was not the expected answer. So it was like, how can this boy say he saves lives? So then he said, he came back with a story, and when our chairman walks the wards, he pats the housekeeping guys on his back, and he says, you're part of the journey and you save lives, because if you don't keep the hospital infection-free, and if you don't keep it like spotlessly clean, especially in the theaters, somebody can die of infection. So in a way, I think this culture has been inculcated in the employees in our organization. And that is why from a day, every day when they come in, they do this. The second thing which we do at Apollo is we have an Apollo anthem. We have 150,000 employees throughout the country, but every day at 9 o'clock, they sing this song about people and wellness and being torchbearers, and the fact that the body is a temple of healing. But after that, there is a moment of silence and a prayer in whichever religion you belong to, saying that, let me work this day for the well-being of my staff, of my patients who come in, and for their families. And I think we've been doing this, we started doing this almost 30 years ago. And I know it's a promise that we will continue it for generations to come. So these are little things which we do. And mental health today, after everything which has happened with COVID, has become so important that talking to them, learning, and we actually have risk scores. We have an app, we have risk scores, and we encourage our staff to take that. When they take it, we at least know where there's an indication. And our largest force is the young ones, which are the nurses. And for them, I think to take this so that we know which way they're trending becomes very important. So that is really one of our initiatives. The second thing is that the loyalty matters and the productivity. Again, the cultures are so different, and I'm just giving you an example of what happens in our country. Our nurses are probably our most valued resource. But then the amount they earn, the wages in India, is probably 1/10 of what they would earn maybe in the UAE or the NHS system or the US. So they always want to go away. And earlier, the trend was to keep their certificates, almost like they were bonded. And that did not help because, they were not really happy nurses. So we took a call after talking to them and hearing that we will not keep them, we will not hold on to their certificates. In fact, English language is so important to them. So we have skilling and learning and language classes for them. So our nurses' attrition, while it is not low, but the nurses coming into the system has gone up because they're just so happy working there. And they talk about it to their patients and the patients' families. So they know that, we have a happy nursing culture working there. We also understand and realize that, you need to have a right mix of people who've been there for a very long time and the new and the younger ones. So there's a buddy system which is in place, which, just makes people, the seniors, saying that you're so responsible for 50 of our staff. Simple things, simple exercises. And they learn and they listen because sometimes, I think the leadership can't listen to everybody. But if there is a system in place, a scientific system, so that there is a listening available, at least people feel like that their voices are heard. And I've seen that working very well in our culture and in our systems. Again, we have hospitals have a very young population, a very young staff. So we Indians love our dancing, we love our yoga, and we like outdoor activities. So 2-3 times a year, they're actually allowed to perform on a stage. And they learn. We have experts coming and teaching them. You've heard about Bollywood dancing and stuff like that. So they're all encouraged to do that and to not be inhibited and to come and dance and perform. And we find that there's so much excitement, just like Pedro made us stand up and talk to each other. There was so much noise. We see that happening in the hospital system, that when this date, which is our Founders' Day, 5th of February, coming up, we see everybody wanting to go and go for dance practice. So what it does is it brings everyone together. There's a certain level of excitement. We have sports, we have exercises, and of course we have yoga, and of course we have breathing. Because if we give them 5 minutes to really breathe, introspect, and meditate, just 5 minutes, we've seen that, and we've got data to show that it's made like a huge difference. But the most important part is to give them a career and a path for the future. And for that, we have training classes. We have a receptionist who now is a CEO. We have a doctor who was a student who's become like, a star resource. So this training, career path, career guidance, and nurturing them, I think, has shown very well. Another example of how we care is that our chairman, about 5 years ago, mandated really, saying that everybody has to go through their health check and do it for their spouse or their family member. So one person plus one and all free in the organization. It was part of our budget. And we realized that people had hypertension, they had diabetes, potential to have cancer or heart disease. And this early screening, early detection, and intervention, because they were insured, made such a big difference for them. And I think this kind of intervention really helped. So we took this program to other organizations. We said, we should never be selfish as an organization. So large corporates were encouraged to do that for them. And I'm so happy to say that we have done almost 8 million checkups throughout the country over the past 5 years. And all this is targeted at just keeping them healthy and happy and having a complete focus on that. We also found that the people working in corporates, the disease level and stress levels are much higher, which I guess everybody knows and understands. But once they know, and once we give them like a health coach or somebody to help them with better lifestyles, obesity, so better eating habits, there is data to show that it has made things much, much better. So in my last remarks, I would like to say that in a way, I think we've gone back a full circle. There's been so much of technology, so much of talk, of fantastic apps on the phone, that we are all as humans, as a race, are trending towards being high-tech. We love the word, we love technology, and we love digitization, and we love all these things. But at the end of the day, we are there for people, we're there for each other, we're there for the patients, we're there for the family. So we need to remember to be high-touch. And when I say high touch, it's the way the doctor interacts with his patients. It's the way a star doctor, and doctors are stars, they're gods all over the world, and we truly, truly worship them. But if that fantastic star doctor goes down to the employees and say, I'm a star, I am here because you made me a star, and if the whole ecosystem did not work to align, if you stars did not align to make me a star, then I may not be one. So I think it's the way we communicate, it's the way we reach out to our employees, it's the way we tell them that we will skill you to be a star in the future, we will be with you in your journey. And I'm so happy to say we just celebrated our 40th year in September. And we found that 20% of our employees are between about 22 years and 40 years. That's a large number. for an organization. There may be doctors, there may be senior nurses, there may be front office, back-end staff, but they're there. And this is because that while we want to be high-tech, and we are high-tech, I promise you that, the high touch never goes away from the work we do. So I would like all of you to join me in a pledge as I end. And it goes like this, and you can repeat after me. Would you just say that? That I will do whatever I can to the best of my ability to keep my organization a healthy and a happier place. And as in Bryan Adams' song, I do it all for you. So thank you all, ladies and gentlemen. So we have a bit of a technical glitch, as I said earlier. So I'm going to try and see. I think the audience has sent us some questions. So while we're waiting for the slides, we will try that. So the first question was, the barometer of care looks like a great initiative. The question would be twofold. Did GPU share the results with the workforce? And what are you planning to do about the findings? Raquel, you want to take that?
Is it? Okay. So after the results, so after the study was conducted, we did a national conference where we presented the results. And the survey was actually also, the results were also distributed by all the institutions, so they are public. And we are trying to incentivize the culture that it's not still it's not still a reality, so we are pushing forward for this to be a reality. We are trying to push also initiatives to discuss small initiatives, local initiatives that can help us to improve our results. But this is an ongoing subject, so we're still working, trying to find out what we can do best, because this is a recent study also, and we need to have more information, more data, to have a more sustainable level of information for us to work in that field.
Dr. Graco, you told me that you're a people's person. When I asked you, what is your mantra, you said, I'm a people's person. What is one piece of advice you have for healthcare leaders?
Well, in my speech, I'm going to talk about, I follow a lot Danny Myers. I don't know, you might know. He's a big restaurateur in New York, and he has a lot of restaurants. And what impresses me is that what he said is, if he had happy employees, he have happy customers. And what I say, and I analyze that, and paraphrasing him, if you have happy employees, you're going to have happy clients and happy patients. So that's what I put like my mantra. It's like, it's a Tom Jobim song, like, the happiness is the biggest thing that exists. It's better to be happy than sad. So we have to bring this to the employees. We have to give them like opportunity to stay happy in the field and inside the hospital and with their jobs, so we can avoid the burnout and you can increase all the environment of the hospital.
I was just curious, do you sing also?
No, I don't.
Otherwise, we could have, since no slides, we would have asked you to sing for us. Thank you. Dr. Henry, let me ask you one piece of advice, really. Recently, incidents were reported in clinical areas, such as medication incidents, patient falls, a number of checklists were generated, multiple things were done. And you spoke, and you were telling me that quality is so important to you, and that while you don't have too many meetings, what you actually do is go there and you talk to them. So how do we help people overcome these mistakes?
I have one here. From patient safety perspective, what we do is to incentivize the report of events. It's very important to have the truth. So we have been working a lot on in a non-punitive culture, proactively helping the people to solve issues in a very preventive way. To receive the reports, you need to be safe, psychologically safe in your areas. And the people should have the opportunity to raise their hand and say, we have a mistake here, what we need to do with this. If the position of the leaders is a non-punitive approach, you will receive the truth. If you don't do that, you're in big trouble. So what we try to do is to convince our people about how to report, how to improve the quality of the services, how we can help them to do their best, and how to learn from that situation. Of course, we receive a lot of reports, which is beautiful about the report we're receiving, is that we are not damaging people. We are receiving preventive issues, which is fantastic in our case. We share that information with different institutions in Colombia because we want to be transparent, but also we share the information with the hospitals around Latin America. Specifically, we have a partnership with Albert Einstein in Sao Paulo, Clínica Alemana in Santiago de Chile, and Clínica Austral in Argentina. And we share how we are doing on the evolution of our quality and patient safety culture. The information is available in the British Medical Journal, by the way, but we published that like 2 months ago or something like that. And we have a baseline for Latin America, and we want to change the status of the patient safety culture in all the region.
Thank you. I think the technology is back on. So Dr. Gallardo, can I invite you to
So
make your presentation?
Okay.
For everyone who's here, Dr. Henry has been the CEO of the Fundación Santa Fe de Bogotá, and he's done some amazing work as a professor of healthcare systems at several universities and published papers on topics related to the Colombian healthcare sector and its reforms. So I asked him what his personal mantra was, and he said he had 3 mantras. So I said, oh, okay. So he said, people first, and people first. So that's Dr. Henry for you, and let's welcome him.
Buenos días para mis colegas colombianos y toda la gente de América Latina. Bom dia, because we are in Portugal. É privilégio, uma honra estar com vocês hoje. Parabéns a todas as pessoas, Ronald, que tornaram possível este Congresso Hospitalar Mundial. Dr. Morato, estou falando. Now let's go to the presentation. I'm going back to English. I try my best with Portuguese. Hello, everyone. It is really a tremendous honor and privilege to be here today, and to be part of the International Hospital Federation is really fantastic. My task today is to tell you about how, in our case, at the Fundación Santa Fe Bogotá in Colombia, South America, we do everything that is possible to connect the well-being of our people with a higher sense of purpose. We think that that's the most important part. So this is my objective, and we strongly believe that a greater well-being in our staff depends on the process you follow to make real the purpose of the organization, the main purpose. And you should have a well-described mission that the people lives, a corporate strategy that takes care of the people, and cultural traits that belong to them. Torre de Belém is right here, it's in front of us. It's a very beautiful example of a worldwide recognized UNESCO heritage site. In our case in Colombia, we have the Carnival of Barranquilla, a city in the Caribbean that has the most important folkloric and cultural festival. We love that, and I will let you know why we love that at the end of this presentation. Let me talk a little bit about who we are. Fundación Santa Fe Bogotá is a private non-for-profit organization, social character. We were established, founded in 1972 with a strong governance model. And I'm not saying something positive about ourselves. We just receive feedback from different institutions, including Joint Commission, that says that we follow international standards. Principles and values are the core of our activity. And I will not talk a lot about the principle of values at the Fundación Santa Fe Bogotá, but let me tell you that respect for our people, for our patients and our families are at the forefront. It's central for our activity. It's the most important, I would say, principle and value. By saying this, this is our main purpose. Our main purpose, as you can see, doesn't say that we have to be the biggest or the most important or famous institution. What our mission said is that we need to lead and positively impact the health sector to contribute to the well-being of individuals and communities. And when we talk about individuals, person, we are talking about our people, our patients, and of course, the families of our patients. At the same time, and I will go without the slides, we have defined a mega, a very ambitious purpose for long term that invites us to have and build better health for Colombia and the region. And below this mega, we have 5 sub-megas, specific strategies that will help us to go and comply with our main purpose. And I will go fast by this. Of course, research is there because we want to share knowledge and we want to be global in how we take decisions. Second, we prioritize education to generate, train and educate the next generations of professionals. We also work with communities, so we go outside our hospitals and our services all around the country to solve typical challenges and on population health. Our most important mega after those 4 is our people again, and we want to obtain from them, to give them a deep sense of belonging that must be expressed in concrete opportunities of their personal and professional development. Our institution today is made up of a very well-recognized university hospital in Bogotá, which has been certified as an academic medical center by JCI. I think Joel should be around. Also, we had a Plenary certification on person-centered care model. We have that certification at gold level with the extension. It does mean that the leadership is collective and that our structure is so horizontal, so the people is allowed to participate in different decisions, as you saw yesterday with Diana's presentation about the governance of our nursing staff. Our national accreditation is at the level of excellence, and Peter Lackman is here. Colombian accreditation was certified by ISQA. Additionally, we had managed to certify 18 clinical care programs, Center of Excellence by JCI, being like this, the institution with the largest number of centers certified outside the United States. Our healthcare system, the one we run, includes a training hospital in Cartagena, and our task there was to replicate the culture we have in Bogota. And the numbers we have right now is that after 3 years of working in that culture, we transferred the most important characteristics to the new hospital. There is a challenge when you build and open a new hospital, is that you should assure to the population, guarantee to the population, that you have the same results. You cannot say anymore to the people in a country, in a community, that you will learn and you will have a curve learn of 10 years to obtain the same results you have in your main building. Today, we are more than 5,000 people with their families working for these purposes that I mentioned already. The management teams, and the management team part of it is here, feels responsible for them and for their families' stability, which is a major issue in our activities. The photo you should be seeing is the new hospital that we want to open in 4 years in the Andean region. And that hospital will cover an estate that is in the Pacific coast. That state in Colombia has the greatest social and economic challenges and needs, and it's a really tough situation. So our dream is to change the situation there. Our goal is continue growing to contribute to closing those terrible gaps in terms of equity and quality that we have in Colombia and in the region. And by having that challenge, we ask ourselves 5 years ago, after 10 years working on value healthcare, what if we break the typical silos we have in the hospitals? Why if we develop a flexible, simple, and proactive service line by clinical conditions, following real needs of patients and families, doing education, promotion to full recovery of the situation, improving the quality of life of the people we serve, but making sure that we follow up in the long term, and we have the numbers to demonstrate that clinical outcomes will be there for long term. We already have 30 clinical conditions organized like this, providing services, as I mentioned, with long-term monitoring on the quality of life of the people. An innovative methodology was developed in our institution to do that. There is not a book in Amazon.com that you can buy to understand how to change that situation in a hospital. But with the collective leadership of our people, we managed to obtain this methodology, and all the areas and the groups in different places we work contribute to create that new methodology. Another challenge that we embrace is joy. As Pedro said before, we want to have a happy environment, and of course, all the things I have mentioned contributes to that because the people feel that they have a purpose. But at the same time, we have a nature strategy, a talent strategy, a human talent strategy, led by Dr. Lleras, by the way, who is here, that creates specific programs, activities, and projects to make sure that the people knows what is going on in the different areas. We are not a big institution as yours, but we are big in Colombia. So we need to have a specific strategies to make sure that that happens. By saying this, in addition to this, I can say that we decide to go outside our hospital and work with the communities to make sure that we challenge the situations in different populations to make sure that we have impact on different important issues like nutrition, maternal care, infant care, and things like that that you know that happens in countries like Colombia. At the end, and I will finish here, our institution is fully oriented in a model that we call person-centered care model. And again, person means our people and all the people we serve. And we pledge to you guys to do that, to think about persons and are not only part of the group of people that we serve in our institutions. And I stop there right now, but we can have long conversations during these 2 days. Thank you very much.
Thank you, Dr. Dr. Gallardo, thank you so much. If I was one of your employees, I would say that I'm so grateful to the leadership for leading us on the quality journey and managing in situations which sometimes are not in our hands. And you've been shown exemplary leadership. Thank you, Dr. Gallardo. Our next speaker, and he's also going to have to speak without slides, is Dr. Graco Alvim Neto. He graduated from UFRJ, the Federal University of Rio, and he is the face of the Brazilian hospital, especially during COVID, and his regular appearances on the national news, and I think led to a recently launched series of public health shows, bringing greater awareness to the public. So he said he's a people's person, but I think he's probably the face of Brazilian healthcare also. So thank you, and please go ahead.
Thank you very much. Bom dia. Good morning. I have to thank you, Dr. Marato and Luis, for giving me this chance, and also to Ronald and Linda to receive me so well. Thank you very much. And I prepared beautiful slides to show a little bit of Brazil and like employing well-being, but I'm going to show okay. It's up here, but it's like opposite. So let's talk about the Brazilian style of well-being. So this is me. We talked already. But Brazil has employee well-being baked in. And why? Because it's the culture, it's the law, and it's a good business. It's the culture. Brazil starts with a culture that values a positive work-life balance highly. The employment structure is very patriarchal. The employer is expected to take care of the employees. Since the beginning of the time, we are responsible for our employees, and it's like a family. And we are also very family-oriented. In practice, this naturally leads to teamwork. So when you see in the organizations, it's like everybody is a friend, everybody is heard, and you can give input to the organization. This is very, very good in Brazil. And you try to make a family inside the work. Sometimes people trying to solve the problems of the others. The transportation to work is paid, and it's not included in the salary. So this is the right of the people. Also, the meals are often provided on-site inside the hospitals or the clinics, or employees may receive debit cards for use in restaurants or even supermarket. What you also have, and it was very difficult to find the good translation, is the basic food parcel. That is an average cost of monthly supply of essential food for a family of 4. And this is given every month to the employees, and it helps a lot. The people that has more needs, we help them with that. And it's the law. And it's the law. First, I was going to talk about the SUS. We have a healthcare system written into the Constitution. This gives to everybody an opportunity to be treated and to have like exams. And also, we delivered medications to chronic disease like asthma, diabetes, hypertension, and HIV drugs for free. The CLT is a consolidation of work laws that spells out specific rights to the employee. At the end of the year, on December, all the employees receives a 13th salary. And this 13th salary they can use to have vacations with the family, or to pay some bills that was not paid during the year, or to use for like parties and buy gifts and presents to their relatives. Some organizations also provide meals or cards, credit cards, to buy in the supermarket, like the meal for the Christmas. Then we have also 30 days of vacations per year with 30% bonus for every employee. And nowadays it's very important that because people can share or divided these 30 days in 3 times, or 2 times, or 3 times, or 2 once. And the FGTS is a savings account that we deposit every month 8% of the salary for the employee. If this employee is fired, there is a fine for 40% of they have in the savings. And also they receive unemployed salary for 3 to 6 months. By law, for every 50 employees, we must have 1 trainee that is like the first job for this, and a young trainee, and 1 disabled team member. So it's very inclusive, like the law is very inclusive. And it's a good business. While SUS is a source of national pride in Brazil, it's often underfunded. So some companies give insurance, a private insurance. And this is considered a great value because people sometimes they prefer and they have the comfort and the security to be in a position that they can be helping during like the diseases. And we have like the magazine exams made a poll, and we find that 83% of the employees value well-being over salary. The hospitals are obviously health-oriented. Many of the hospitals now we have they offer gym memberships with great discounts rates, as well as in-site acupuncture and Reiki treatments. It's been a very good experience, and in some public hospitals also. We, like FPH and IERJ is the Association of the States of Rio de Janeiro, where I belong also. We give, we made some partnership with some university, and you get for these employees 60 to 70% of discounts in the payments of the university. And we also reinforce, and like FBH also has a university. And we also reinforce continuous education for the employees, giving them for new talents or reception or the billing, and we offer course during all along the year. And it's a good business, and I was, like I said before, happy employees make healthy patients. And I leave you with the Danny Myers saying that the only way a company can grow is stay true to its soul and remain consistently successful is to attract, hire, and keep great people. Thank you very much for this opportunity.
Dr. Graco, thank you so much. I do have to apologize that we did have a lot of technical glitches. We have kind of gone a little over time, so we won't be able to answer all the questions. But the takeaways from this was that I think we have to focus on our employees, make them feel important, look after their health and well-being. You heard that from all our speakers. Make them more empowered. And remember to listen, remember to give feedback. So at the end of the day, I think leadership has to focus, put employee time into their calendars more than anything else, and less meeting times, as you said, Dr. Henry. Having said that, there's been a lot of questions. We will see that they get answered. I will ask the organizers to please send it to all of us. I would have loved to go through all that. But having maybe one question, Pedro, I would like to say, what are the pebbles in your shoes and what inspires your joy? That's probably the last one. I thought we should end up feeling joyful.
Yeah, and I'll take the chance, obviously, to give a sense of some of the things that I think we probably could all do into the future based on your pledge. So pebbles in my shoes, for me, it's bureaucracy. Red tape that's unnecessary, and that resonates when I'm out there working with institutions and governments and so on. So I get frustrated when I feel it takes 5 steps as opposed to 1 or 2. So that's one. And what brings me joy is the possibility of working with human beings who care and who are in the ethos of serving. That's an incredible opportunity in life. So I feel very privileged for doing that. And I'll take the chance to say something that I probably should have said in my presentation, which is a phrase that stuck with me. Unless, and it applies to our efforts in equity too, your efforts in equity. Unless we are part of the problem, we cannot be part of the solution. And it's about holding the mirror up to ourselves around staff well-being, and even if we are decent listeners, to be better, even if we think we have a clear purpose, to refine it, even if so, there's something about owning this opportunity and challenge to care for and with people and drive forward with a view that this job will never end. We won't get employee well-being solved. We will continue to progress and continuously improve it. So thank you, and a great question.
Thank you all very much. And could you please give our speakers a big hand? Thank you.